Hello everyone. Today I'm going to discuss about the most important topic, that is the mechanism of labor. So, before knowing what is the mechanism of labor, we must know certain terms, or we must go through certain terms. That is the lie of the fetus. The term lie means what relation is the fetal spine with the maternal spine. So we can say how the fetal spine is with the maternal spine. In this case, as you can see, this is longitudinal or parallel. So the lie is longitudinal as the fetal spine is parallel to the maternal spine. The next one is the attitude. Attitude is something which is the relation of the fetal body parts, that is totally flexed, the body part. So we can tell the attitude is flexed. Next is the denominator. Denominator is termed the position or the part of the fetus which touches the maternal pelvis, or the landmarks of the maternal pelvis. So in this case, we can say the denominator is the occiput. Now, about the position. Position is the point where the denominator touches. It can be LOA or it can be ROA. So these two are the most commonest positions. Like, what is presentation? The part of the fetus which enters the pelvic cavity of the mother. So it is termed as presentation. So in this case, we can say that it is cephalic in presentation. So what are all? The lie is longitudinal, the presentation is cephalic, the denominator is the occiput, the position is LOA. Before knowing the mechanism of labor or the cardinal movements of mechanism of labor, we must know what is mechanism. Mechanism is the series of movements that take place of the fetal head for the process of adaptation through its journey from the maternal pelvis. Okay, so first movement is engagement, as you can see. So after engaging, the fetus descends down, and after descending down, it gets resistance from the uterine contraction, uterine muscles, and also from the bony structures of the pelvis, and it gets flexed. Okay, I'm showing you like this. So the head of the fetus gets flexed. After getting flexed, there is internal rotation of the head. Then there is crowning. After crowning, there is extension of the head or the delivery of the brow, eyes, then face. Then restitution or torsion of the neck, release, external rotation of the head, internal rotation of the shoulder, then lateral flexion. By the process of lateral flexion, delivery of the anterior shoulder, then posterior shoulder, then all over all the trunk and the extremities by the lateral flexion. So this is all about the process of mechanism of labor. As I said that, but you have to keep in mind that when we are doing flexion of the head, the flexion of the head is something where the chin of the fetus touches the neck. Then when we are doing internal rotation, that time there is a torsion of the neck. So internal rotation is rotated around 45 degree, but there is a torsion. So after getting out or after extend delivery of the head, there is release of the torsion of the neck and also restitution. From outside we can see, now from outside, external rotation of the head again 45 degree and internal rotation of the shoulder to make the alignment, and then the delivery of all the trunk by lateral flexion. So this is all about mechanism of labor. Thank you so much.